Hello everyone, and welcome to today's webinar where we will be discussing sinus bradycardia. Specifically, we'll be talking about first degree, second degree type 1, second degree type 2, and third degree blocks in bradycardia. Bradycardia is defined as a heart rate of less than 60 beats per minute. While any heart rate less than 60 beats per minute is considered bradycardia, not every individual with bradycardia is symptomatic or having a pathological event. Individuals in excellent physical shape often have sinus bradycardia. Symptomatic bradycardia may cause a number of signs and symptoms, including low blood pressure, pulmonary edema and congestion, abnormal rhythm, chest discomfort, shortness of breath, lightheadedness, and/or confusion. Symptomatic bradycardia should be treated with the ACLS survey. If bradycardia is asymptomatic but occurs with an arrhythmia listed below, which we will talk about in the later slides, obtain a consultation from a cardiologist experienced in treating rhythm disorders. So, sinus bradycardia can be identified. The regularity of it is the RR intervals are regular, overall rhythm is regular. The rate is less than 60 BPM, but usually more than 40 BPM. As far as the P wave goes, there's one P wave in front of every QRS. The P waves appear uniform. And for the PR interval, it measures between 0.12 and 0.2 seconds in duration. PRI is consistent. For first degree AV block, RR intervals are regular, overall rhythm is regular. The rate relies on the underlying rhythm. There's one P wave in front of every QRS. The P waves appear uniform. The PR interval measures more than 0.2 seconds in duration and is consistent, and the QRS complex measures less than 0.12 seconds. For second degree type 1 AV block, the RR interval is irregular, but there is usually a pattern to it. The RR interval gets longer as the PR interval gets longer. The ventricular rate is usually slightly higher than the atrial rate due to some atrial beats not being conducted, and the atrial rate is usually normal. The P waves are upright and uniform. Most complexes will have a P wave in front of them. However, there will be some that do not have a P wave. And the PR interval gets progressively longer until there is a dropped QRS complex. For second degree type 2 AV blocks, if there's a consistent conduction ratio, then the RR interval will be regular. If the conduction ratio is not constant, the RR interval will be irregular. The atrial rate is normal. The ventricular rate is slower, usually 1.5 to 1/3 slower than the atrial rate. The P waves are upright and uniform. There's not a QRS following every P wave. And the PR interval can only be measured on conducted beats and is usually constant across the strip. It may or may not be longer than a normal PR interval, which is 0.12 seconds. For a third degree AV block, the RR intervals are regular. PP interval is also regular. The atrial rate is regular and normally 60 to 100. Rate of QRS complexes is dependent on the focus. If the focus is ventricular, the rate will be 20 to 40. If the focus is junctional, the rate will be 40 to 60. The P wave is upright and uniform. There's not a QRS following every wave. And the PR interval can only be measured on conducted beats, and it is usually constant across the strip, so it may or may not be longer than a normal PR interval, which is, again, 0.12 seconds. The QRS complex interval may be normal, but is likely to be prolonged. So a little review of everything we talked about for symptomatic bradycardia. The sinus bradycardia is a normal rhythm with slow rate. A first degree AV block is a PR interval that's longer than 0.2 seconds. Type 1 second degree AV block will have a PR interval that increases in length until QRS complex is dropped. A type 2 second degree AV block will have a PR interval that's the same length until intermittently dropped. QRS complex is dropped. And third degree AV block is PR and QRS are not conducted with each other. Don't forget we offer online ACLS certification on our site. You can find a link to it in the description. We encourage you to become certified as soon as possible, whether that be on your own time, with an online course, or in an in-classroom setting. So thank you so much for tuning into today's webinar. We will catch you next time.